Arthritis is a word many of us have heard before. But what does it really mean? Put simply, arthritis means inflammation of the joints. Imagine the places where your bones meet, like your knees, fingers, or hips. These are your joints. They have a soft cushion that helps them move smoothly. When you have arthritis, this cushion can wear down, or the area can become swollen and painful. This condition isn't just one single disease. In fact, there are more than 100 different types of arthritis. The most common ones are osteoarthritis, which happens from wear and tear over time, and rheumatoid arthritis, where your own body's defense system attacks your joints. It can affect people of all ages, not just the elderly. When we talk about the symptoms of arthritis, the most common one is pain in the joints. This pain can be a dull ache, or it can be a sharp, intense feeling. It might come and go, or it could be constant. Another major symptom is stiffness. Many people with arthritis feel very stiff when they first wake up in the morning or after sitting for a long time. This stiffness can make it difficult to start moving. You might also notice swelling around a joint, where it looks puffy and can feel warm to the touch. The skin over the joint may also look red. These signs tell us that there is active inflammation happening inside. Beyond these main symptoms, a person with arthritis might notice other changes. Their range of motion could decrease. This means they may not be able to bend or straighten a joint as fully as they once could. For example, it might become hard to bend down to tie your shoes or to reach for something on a high shelf. You might also hear strange sounds coming from your joints, like clicking, cracking, or grinding noises when you move. This is called crepitus. While it can sometimes be harmless, in arthritis it often happens because the smooth cartilage that covers the bones has worn away, causing the bones to rub directly against each other. It is so important to understand that these symptoms are not just minor inconveniences. They are signals from your body that something is wrong. Paying attention to them is the first step toward getting help. If you experience persistent joint pain, stiffness that lasts for more than 30 minutes in the morning, or swelling that doesn't go away, it is a good idea to talk to a doctor. Getting a proper diagnosis is crucial because different types of arthritis require different treatments. A doctor can help figure out exactly what is causing your symptoms and guide you toward the best plan to manage your health and protect your joints from further damage. Living with arthritis can change daily life in many ways, both big and small. Simple tasks that many people take for granted can become challenging and painful. Imagine trying to open a jar of pickles, but your hands are so stiff and sore that you can't get a good grip. Or think about buttoning a shirt, an action that requires fine finger movements that might now be difficult. Even walking up a flight of stairs can feel like climbing a mountain when your knees are aching with every step. The persistent pain and stiffness can turn a regular day into a series of obstacles to overcome, requiring extra time, effort, and planning for even the most basic activities. This condition affects more than just physical movement. It can also impact your energy and mood. Many people with arthritis experience fatigue. This isn't just feeling a little tired. It's a deep, overwhelming exhaustion that doesn't always go away with rest. This fatigue comes from the body constantly fighting inflammation and dealing with chronic pain. When you're always in pain and feeling tired, it's natural for it to affect your emotional well-being. It can lead to feelings of frustration, sadness, or even anxiety about the future. The unpredictability of symptoms, where you might feel fine one day and terrible the next, can make it hard to make plans. Work life and social activities can also be affected by arthritis. A job that requires standing for long hours, typing on a computer, or lifting heavy objects might become impossible to continue without making some changes. This can cause financial stress and a loss of identity for some people. Socially, you might have to say no to invitations to go for a walk with friends or play a sport you once loved. This can lead to feelings of isolation. Explaining your limitations to friends, family, and coworkers can be difficult, as arthritis is often an invisible illness. People can't see the pain you are feeling, which can lead to misunderstandings. Because of these challenges, people with arthritis often become incredible problem solvers. They learn to adapt and find new ways to do things. They might use special tools in the kitchen to help with gripping, or they might rearrange their home to make things easier to reach. They learn to listen to their bodies, knowing when to push through and when to rest. This daily management is a constant balancing act. It involves pacing yourself, breaking down large tasks into smaller, more manageable steps, and not being afraid to ask for help when it is needed. It's about learning to live with the condition, not just suffer from it. When it comes to treating arthritis, there is no one-size-fits-all solution. The goal of treatment is usually to reduce pain, minimize joint damage, and improve or maintain your quality of life. One of the mainstays of treatment is medication. For osteoarthritis, simple pain relievers like acetaminophen or non-steroidal anti-inflammatory drugs, such as ibuprofen, can help manage pain and reduce swelling. For inflammatory types like rheumatoid arthritis, doctors often prescribe stronger medications called disease-modifying anti-rheumatic drugs, or DMARDs. These drugs work to slow down the disease and prevent permanent damage to the joints by calming the overactive immune system. Physical activity and therapy are also incredibly important parts of any arthritis treatment plan. It might seem counterintuitive to move a joint that hurts, but regular, gentle exercise is one of the best things you can do. Movement helps to keep the joints flexible and strengthens the muscles that support them. Strong muscles act like shock absorbers, taking some of the stress off the joints. A physical therapist can create a safe exercise program for you. This might include low-impact activities like swimming, walking, or cycling. They can also teach you exercises to improve your range of motion and show you how to perform daily tasks in a way that protects your joints. Lifestyle changes can also make a huge difference in managing arthritis symptoms. Maintaining a healthy weight is one of the most effective things you can do, especially for arthritis in weight-bearing joints like the knees and hips. Every extra pound of body weight puts several extra pounds of pressure on your knees. Losing even a small amount of weight can significantly reduce pain and improve function. A balanced diet, rich in anti-inflammatory foods like fruits, vegetables, fish, and nuts may also help. Some people find that using hot and cold therapies, like a warm shower to ease morning stiffness or an ice pack to reduce swelling, provides temporary relief. In some cases, when the joint damage is severe and other treatments are no longer effective, surgery may be an option. The most common type of surgery for arthritis is joint replacement. In this procedure, a surgeon removes the damaged parts of the joint and replaces them with a new, artificial joint made of metal and plastic. Hip and knee replacements are very common and have a high success rate, helping to relieve pain and restore movement for hundreds of thousands of people each year. Other surgical options might include joint fusion, where bones are fused together to make the joint more stable and less painful, though this does eliminate movement in that joint. A question I often hear is there a cure for arthritis? As of today, November 14, 2025, for most types of arthritis, there is no definitive cure. This can be a difficult thing to hear. However, this does not mean there is no hope. Medical research is constantly moving forward. Scientists are learning more every day about what causes different forms of arthritis, and this knowledge is leading to better and more targeted treatments. The treatments we have today are far more effective than what was available just a few decades ago. They can slow the progression of the disease, manage symptoms effectively, and allow people to live full and active lives. For anyone living with arthritis, there are many simple, practical tips that can help make life easier. It's all about working smarter, not harder. In the kitchen, use electric can openers and jar openers. Choose lightweight pots and pans with handles on both sides. When getting dressed, use a long-handled shoehorn and consider clothes with zippers or Velcro instead of small, difficult buttons. Throughout your day, remember to pace yourself. Alternate periods of activity with periods of rest. Don't try to do all your chores at once. Breaking tasks into smaller chunks can help you conserve energy and avoid a flare-up of your symptoms. It's also crucial to build a strong support system. Don't be afraid to talk to your family and friends about what you're going through. Let them know how they can help. Sometimes, just having someone to listen can make a big difference. You might also want to connect with others who have arthritis. Support groups, either in person or online, can be a wonderful resource. Sharing experiences and tips with people who truly understand what you're feeling can reduce feelings of isolation and provide practical advice. Your healthcare team, your doctor, physical therapist, and others are also part of your support system. Stay in regular contact with them. Finally, I want to end on a message of encouragement. A diagnosis of arthritis is not the end of your active life. It's the beginning of a new way of living. By understanding your condition, working closely with your doctors, and making smart lifestyle choices, you can take control. You have the power to manage your pain, protect your joints, and continue doing the things you love. The journey may have its challenges, but with the right tools and a positive mindset, you can navigate it successfully. Stay informed, stay active, and most importantly, stay hopeful. the future of arthritis treatment is bright.